Brownsville. I'm Michelle Jones, the city's epidemiologist, and we want to welcome you to BTXCARES Talks. And this is where we discuss those important topics that are affecting our community. And for today's edition, we have Mr. Wesley Milum, the Emergency Room Director from Valley Baptist Medical Center here in Brownsville. And why don't you tell us a little bit about yourself, Wesley?
So as you mentioned, my name's Wesley Milum. I'm the ER Director at Valley Baptist in Brownsville. I've been here, born and raised in Los Fresnos, Brownsville. Cameron County has been my home, and went to school here. Got my nursing degree at UTB when that was still a university. Now it's UTRGV, and I've worked at Valley Baptist my whole career in and around the emergency department. And it's really great to be here. Thank you for inviting me.
Thank you so much for coming. So one thing, since we are here to talk about the COVID-19 pandemic, do you mind telling us a little bit of the experiences you've had when you're dealing with COVID-19 patients and what you're seeing?
So it's been quite a roller coaster ride. As many people remember when it first came out, there was a whole lot of hurry up, prepare, and a whole lot of waiting. And then we kind of hit our first wave last summer in June, July, August, and kind of rolled into September, and then we experienced another lull. So there's this big roller coaster ride that we've experienced, but there's a whole lot from the healthcare community that's very almost pride worthy of how we've been able to be resilient in caring for our neighbors, our friends, our family. But it's also overshadowed by a lot of darkness. It has taken a tremendous toll on the citizens and our neighbors and our friends through illnesses and now chronic conditions due to COVID-19, and ultimately several people that have lost their lives to COVID-19. So it's been a very challenging year and a half or so as we've been battling this pandemic.
I'm glad you mentioned how challenging it is, because one thing that we think about is how does the frontline workers, nursing staff, doctors, how are or what are some of the ways in which you guys help lift each other up and support each other, because it's such an emotional toll on that frontline worker?
So it is very difficult, and there are some times to where we're not real great at it. We'd love to say that no, everything's great. Every time you come to the hospital during the middle of a COVID pandemic, we're all charged, energized, ready to take care of everybody. But we have family members that were affected too. We've lost loved ones. We've ourselves have fallen ill to COVID-19 before the vaccine came out. And just to see the overall toll of that's very, very difficult. However, when we get through very difficult scenes, scenarios, patient care episodes that we're dealing with, there's also a tremendous amount of pride that as we kind of sit and when there's a little bit of a lull in the wave and the influx of patients, we can reminisce about all the great things that we've done, and whether it's been the triumphal ability to get somebody off of a ventilator, to get them back to their home, to their family, or whether it's the final moments of holding somebody's hand that ultimately dies of COVID-19, we know that we've made an impact for the better in the lives of people. And while we still fight the pandemic, we still stand side by side with one another as healthcare workers, but with our community. This is our family, it's our friends, it's our neighbors. And so there's been a lot of that has been extremely prideful in the work that we've done and what we've been able to accomplish over the past 18 months or so.
That's good, and we thank you for always being there and helping us through those difficult times. One thing that we always want to mention, especially now that we do have a vaccine, is we encourage everyone to get that vaccine because it helps protect us all. But we do know that there are individuals who just don't, for whether it's religious beliefs or they're kind of afraid or they want more time. Have you ever had a patient who asked for the vaccine after they've entered the hospital, where we know at that point it's a little late in the game?
It is a little bit too late in the game once you've have an active infection of COVID-19. And especially recently, now that the vaccine's readily available, between the vaccine clinics we've been running at the hospitals and throughout the entire county and all sorts of healthcare partners, we're literally now searching for arms to give the shots to. We're like trying to find people that are willing to take the vaccine, and we are seeing a very, very, very dark trend, and it is that anti-vaccine remorse as people are coming in. And people really don't understand what that actually feels like when you're not able to breathe, you're not able to oxygenate. And the best thing for somebody who's never dealt with true shortness of breath and the inability to get oxygen into your lungs and into your bloodstream, imagine being underwater and that desperate attempt to get up to the air. at that point, you see that remorse of somebody that knows that I could have got a vaccine, all of this could be prevented, and I could be potentially home with my family members. And some of the worst that we've seen is some of us relatively younger people who aren't at high risk of COVID, but we end up contracting it and we fare fairly well, something along the lines of the flu. It beats us down, we're in bed for a few days, but we end up going to see an elderly family member or friend, and they don't fare as well as a lot of the younger population. So that vaccination is not only important to protecting directly you or your loved ones from getting that, but from you spreading it as well. And we are seeing a lot of remorse from people who didn't believe they needed it, didn't think that they thought they could overcome it on their own. But now that they're showing up to our ERs, overwhelming our ICUs, there's a lot of remorse there for those that have not been vaccinated.
And that's real important because if we're discussing the longevity of this pandemic, it doesn't look like it's going anywhere. What are your thoughts on that?
So the way this virus works and with the different variants that we've seen, it's very clear we're going to continue to battle this much like we do with seasonal influenza. Every year the flu strain mutates, and we're used to that and we get that. We'd all love COVID to go away. I would love COVID to go away. There's some really great data out there right now in Cameron County. I believe Cameron County's reports just as of yesterday is that we're nearly 70% of the residents 12 years and older are fully vaccinated. Those are great numbers. However, when you take those percentages out, that's 30% of nearly 450,000 people in this county that are not vaccinated. That's over 100,000 people still in this county that are not vaccinated. In my hospital here in Brownsville, I've got 21 beds in my ER, and we've got 24 ICU beds. That's a stark discrepancy in beds available to care for people and number of people that are still at high risk for contracting COVID-19 and ultimately getting severe COVID, which would require hospitalization and treatment. So while there's some really good, the silver lining to that, there's still a lot that we can do to continue to stamp out this pandemic and to return to our lives of some sense of normalcy.
So I'm just going to let our population know that you can get vaccinated if you're 12 years and older.
Absolutely.
So just keep that in mind when you're moving about your day. These are available to you, so we really want to stress that.
And something I'd like to add on to that is there is a lot of hesitancy with vaccines and even from all the healthcare community, understandably so. It's a brand new medication, it's a brand new treatment, and you hear things like it's unproven, it's this, and there's a lot of studies out there that show the promising positive effects of the vaccination. But the one thing that I would say that is probably the most important thing is our hospitals right now are full, inundated, and overwhelmed of unvaccinated COVID patients. I don't have any patients in there that are being treated in the hospital because of a vaccine reaction. That is very rare, and we don't see it at the hospital setting. But what we do see is a lot of unvaccinated patients on ventilators requiring high amounts of oxygenation that are suffering permanent lung damage, and patients that are losing their lives because they were unvaccinated. And from the healthcare perspective, it's very heartbreaking.
Yeah, because you know that they didn't necessarily have to be
That's
there
correct.
if they were able to have the vaccine. And I think it's also important to note that some people, because we do have that younger group that aren't able to get vaccinated.
Correct.
As long as we're all getting vaccinated, we're also hoping to protect that, especially that younger generation, or maybe someone who has a healthcare condition that's preventing them to get the vaccine right now, but might be eligible in
Absolutely,
a month. So,
and the higher we can get those percentages up, the more we can approach herd immunity. And there's a lot of studies out there that say 70, 80% is going to get us into that range, and we're kind of flirting with that.
Yeah.
But what we're feeling in the hospitals is not that.
Yeah.
We're still seeing ambulance after ambulance show up at our doors, people coming in through the front, through our waiting areas, through triage, that are walking in with critically low oxygenation levels. And this is not what we thought it was going to be, an elderly disease, our geriatric population. We're seeing 20-year-olds, 30-year-olds that are having to have serious respiratory support just to get baseline oxygenation levels into their systems, and it's very unfortunate.
So that's really great information to know. And one thing before we close out, is there something that, if you could say anything to our community, what would it be in regards to?
Well, we've talked very heavily about vaccines.
Yeah.
That is the single most effective method. You know, there's a lot of methods out there. There's masking, there's hand washing, just basic respiratory hygiene, covering your cough and those types of things. However, none of those things are as effective as the vaccine. When initially in the first strain of COVID, you were looking at 94, 95% for the Moderna and the Pfizer vaccines. With the Delta variant, we're still trying to see what that adjustment looks like, but we're still seeing very few people show up into the hospital, and it's still highly, highly effective and preventing that severe COVID. What's going to put you in the hospital? What's going to take your life? Vaccines are still extremely effective in preventing that. And I would say if there's one thing that you can do, if you don't want to wear a mask, you don't want to wash your hands for whatever reason, get vaccinated. It is the one thing that has proven time and time again at the hospital setting, we are not having to deal with those patients.
All right. Thank you so much.
Absolutely. Good to be here.
So I'd really like to thank you, Wesley, for
Absolutely.
taking the time out of your day, because we know with the hospitals and the ERs being so packed out, it's really important that you got this information out to us.
I do appreciate it. There's a lot of work still to be done, and there's many months of caring for COVID patients still to go, but anytime I have an opportunity to shed some light on what we're dealing with on the hospitals, and I'd love to be able to get that message out.
Thank you. We appreciate that.
Absolutely.
And we hope the community found this information beneficial, and if you still need additional information to feel comfortable about making some of these decisions, make sure you're visiting cdc.gov, or you can always call our COVID hotline at 956-394-0012. For BTX CARES Talks, I'm Michelle Jones, the city's epidemiologist, reminding you to stay safe, stay sanitized.